Face-to-face training microbiology tracked module 4 name facilitator 1 position, name facilitator 2 position, name facilitator 3 position. Name facilitator 1 position. Activity port oleo. Name facilitator 2 position. Activity port oleo. Name facilitator 3 position. Activity port oleo. Introduction QWRS project. The QWRS training program. The QWRS program has 2 parallel training tracks. Only participants that have completed e-learning modules can participate in the face-to-face training courses. Microbiology skilled, epidemiology skilled, introduction to AMR data management, bacteriology testing, basic data management and analysis equipment maintenance, sampling and surveillance, quality management, communication skills. Microbiology expert, epidemiology expert, advanced techniques, spatiotemporal analysis, supervision skills. This Module 4 course consists of 2 components. 1. Theoretical component. 2. Practical component. The Module 4 course will help you to improve your practical knowledge and skills in bacteriology testing for the identification and antibiotic susceptibility testing, AST, of glass priority pathogens. Using a variety of up-to-date methods that are in line with international microbiology diagnosis guidelines using a One Health approach. After this training, you will be able to 1. Perform sample management, acceptance, transportation, handling, storage, according to standardized procedures. 2. Describe the major identification methods for priority pathogens. 3. Describe the major resistance mechanisms for different classes of antibiotics used for glass priority pathogens. 4. Perform routine culture and AST of glass and other regionally identified priority pathogens safely, effectively, and efficiently according to standardized procedures. 5. Perform procedures for isolation of the different zoonotic or indicator organisms from animals, including selective enrichment. After this training, you will be able to 6, 7, 8, 9. Perform quality control and quality assurance procedures and be involved in quality management to ensure high quality, correct test results. Detect and analyze nonconformities and design and implement corrective measures. Analyze, interpret, and report test results for AST. Communicate with other stakeholders regarding sampling, testing, and result interpretation. 10. Identify, critically analyze, and apply reliable information regarding new developments in the field of AMR testing. Day 1. M4-1, Overview of glass priority pathogens. M4-2, Description of bright field optical microscope. M4-3, Preparation of colonies for wet and gram stain. M4-4, Mixture of 2 or 3 different bacteria in broth medium. 4. Wet and gram. M4-5, Preparation of samples for staining methods, gram and methylene blue, in addition of wet preparation if applicable. M4-6, Reading and interpretation of gram stain with selected slides. Day 2. M4-7, Overview of commonly used culture media and inoculation. Methods. M4-8, Inoculation of culture media with sample, based on the morphology of the bacteria observed on the gram stain. M4-9, Inoculation of appropriate culture media to isolate and differentiate bacteria from mixed broth cultures based on the gram stain. M4-10, Introduction on urinary tract infection, UTI, diagnosis. M4-11, Urine dilution culture method. Day 3. M4-12, Overview of bacterial phenotypic identification based on cultural and biochemical characteristics. M4-13, Culture results interpretation. M4-14, Biochemical tests for gram-positive cocci, Staphylococcus, Streptococcus, and Enterococcus. M4-15, Standard Biochemical Gallery and API Galleria for Gram-negative. Bacilli, enterobacterial and non-fermenting organisms. Day 4. M4-16, identification of strains by analysis of culture results and biochemical characteristics. M4-17, general introduction on culture media. M4-18, media preparation. Day 5. M4-19, introduction of automated identification systems. M4-20, introduction of automated identification systems. M4-21, MALDI-TOF, only in demonstration if available during incubation. Time of M4-20. Day 1. M4-22, introduction to glass bug-drug combinations. M4-23, overview of manual methods for antibiotic susceptibility testing, AST. M4-24, discs diffusion method. M4-25, e-test method. M4-26, micro-dilution method in liquid medium, mic determination. Day 2. M4-27, reading and interpretation of antibiogram. M4-28, overview of automated systems for AST. M4-29, Vitec 2 or other automated equipment. Day 3. M4-30, introduction on multi-drug resistant, MDR, pathogens. M4-31, reading and interpretation of selected MDR phenotypes. Day 4. M4-32, reminders on bacteriological characteristics and AST. Day 5. M4-33, reminders on AST interpretation phenotypes. Think for a minute and write down. What do you want to know after this training course? What do you want to feel after this training course? What do you want to do after this training course? You will do the practical work. A lot of interaction with the facilitators. Learn from each other. Dare to ask questions. Stupid questions do not exist. You will get the presentations for the theoretical sessions before the end of the course. You will have final assessment to test a panel of unknown samples. Identification of strains according to size, appearance, morphology. Pigmentation and type of hemolysis of colonies O biochemical test for isolated strains OAST. Have fun! House rules. What are the requirements to have an optimum learning environment during the workshop? Permission for communication. Lot of practical exercise. Homework. Heavy checkmark. Fill the learning logbook. Heavy checkmark. Get information for tomorrow's sessions. Questions.